This video will demonstrate the bifrontal craniotomy and anterior interhemispheric approach for clipping of pericallosal and callosal-marginal artery aneurysms. The patient was in his late 50s. He presented with bilateral tremors and headache. He was found to have multiple incidental aneurysms, which he wanted treated. On exam, he was intact. His CT angiogram shows the multiple aneurysms arising from the bifurcation into the pericallosal and callosal marginal arteries, as well as just distal to that. The MRI also revealed some unusual cystic lesions in the cingulate gyrus on the left side. The head was positioned with the midline horizontal so that gravity could retract the right hemisphere and open the interhemispheric fissure. The incision and craniotomy are shown. Strategy consisted of the supine position with the head turned to the right, bifrontal craniotomy, anterior interhemispheric approach, distal dissection of the pericallosal arteries, anterior dissection of the first aneurysm, posterior dissection of the second aneurysm, clip reconstruction of both aneurysms, and IC green video angiography to confirm patency. Here's an overview of the surgical exposure. The nose is to the right, the back of the head is to the left, and the superior sagittal sinus is at the top of the screen. Notice how gravity pulls down on the right frontal lobe to open up the interhemispheric fissure. Here, the first aneurysm comes easily into view. There are multiple adhesions between the lateral fundus of the aneurysm and the cingulate gyrus. These are released. Notice the bright white corpus callosum coming into view at the depths of the field. You can also see the pericallosal vessels below. The cingulate gyri here are densely adherent and are separated further. This anterior dissection revealed the second aneurysm. You can see a small bleb on the shoulder of a branch coming from the aneurysm bifurcation. Here you see the fundus of the aneurysm coming into view, again with multiple adhesions between the fundus and the adjacent cingulate gyrus. These are released. The anatomy is brought into view. And now the aneurysms are both ready for clipping. This anterior one is clipped first. A straight blade closes the thick portion of the fundus. This bleb on the shoulder is addressed next with a curved clip. The curve is pointing forward, and it grabs the thin wall, the cherry red portion of the sac, into the blades. A third clip here closes the portion between the two other clips. Now we turn our attention to the first aneurysm. Some additional dissection is needed to free it from its adhesions to the cingulate gyrus on the contralateral side. And now the full aneurysm is in view. Again, there is a broad base and a thick-walled dome. This straight clip goes across the base of the aneurysm and closes off the sac of the aneurysm. This bleb here on the shoulder of this branch artery is being clip occluded with a down-curved mini-clip. The portion between the two clips is now closed with this straight mini-clip in between the tips. This now reconstructs the bifurcation nicely. IC green video angiography shows that flow in the parent and branch arteries is nicely preserved, and there is no filling of the aneurysm. Here is the overview showing both aneurysms clipped simultaneously through a single exposure. The illustration on the left shows the anatomy of the anterocerebral arteries. Notice how the pericallosal and callosal marginal arteries originate from the A3 segment of the anterocerebral artery, which is the portion that wraps around the genu of the corpus callosum. The illustration to the right shows the various positions of these aneurysms, which can be located at the genu or over the body of the corpus callosum. The relationship of the branch arteries to the neck determined the clip configurations, and several examples are shown in this illustration. The patient tolerated the procedure well. He had no neurological deficits and was discharged home on postoperative day 2. His postoperative CT angiogram shows good clipping of the aneurysms with patency preserved in the parent and branch vessels. In conclusion, pericallosal aneurysms account for a small fraction of all intracranial aneurysms and, despite their small size, have a high rupture rate. Pericallosal artery lies on top of the corpus callosum, whereas callosomarginal artery courses in or near the cingulate sulcus parallel to the pericallosal artery. The bifurcation into the pericallosal and callosomarginal arteries is most often in the A3 segment along the genu of the corpus callosum. Positioning the midline horizontally to allow for gravity retraction widens the interhemispheric corridor and facilitates simultaneous clipping of multiple aneurysms. Thank you.